Over is high, and vulnerable children in Texas are left unprotected. State lawmakers agree that Child Protective Services is an agency in crisis. Back in November, Channel 2 Investigates reported hundreds of children considered at risk were not being seen by caseworkers within the required time frame. Well, 4 months later, we're checking on the state's plan to fix this crisis. Investigator Robert Arnold updates the progress of new funding and new proposals in Austin.
She was a beautiful child.
The shortcomings are haunting. A 4-year-old Dallas area girl beaten to death, her parents charged with the crime.
This was a tragedy that should have never happened.
A 5-year-old girl stabbed to death in Kyle, her mother charged with murder.
I can't sleep ever since that day that happened.
Child Protective Services had been involved in these children's lives, yet the state's safety net failed.
As long as I've been here, we've had 50, 100 kids dying in the custody of Child Protective Services.
Last November, Channel 2 Investigates showed you how lawmakers began scrambling to overhaul a system plagued by missteps, high staff turnover, crippling caseloads, and low morale.
I can tell you that children are not being seen.
Children in the greatest danger of being abused or neglected are considered Priority 1 cases. State law requires CPS to have face-to-face meetings with these children within 24 hours of getting a call. The latest data obtained by KPRC shows CPS still misses that mark nearly 15% of the time. In our area, that number is around 30%.
Something's not working.
Dr. Robert Sanborn is president and CEO of Children at Risk, a nonprofit organization that works to better the state's child welfare system. Is it a system that is broken, or is it just a system that doesn't have the resources it needs to meet the demand?
It's absolutely a system that's been underfunded.
At the end of 2016, lawmakers gave CPS an emergency infusion of $142 million to hire more investigators and give employees a raise. Then, lawmakers filed several bills to overhaul CPS. House Bill 5 would make the Department of Family and Protective Services, which houses CPS, a separate agency answering directly to Governor Greg Abbott.
You want the governor to pay attention to this stuff because this is something that needs a lot of attention.
House Bill 4 would increase payments for certain families who agree to take care of abused and neglected children who are their relative.
Okay, members, we've got one thing done to help our children. Let's do another.
There is also Senate Bill 11. This bill would essentially privatize certain parts of CPS's casework by having the agency partner with local nonprofit organizations.
This is an issue that we all need to get right.
These are good initiatives, but they're not necessarily solutions.
Sanborn says these measures will need to be constantly evaluated and updated to be truly effective. He also adds a one-time infusion of cash will only temporarily ease CPS's burden.
We have a history in this state of saying that we care about our children, and then we throw a little bit of money, especially when that's in the news, to say we're taking care of this, and then we move on.
All of these bills have passed their respective houses but have not gone to full votes to become law. It is likely, though, that will happen since the governor, lieutenant governor, and speaker have said fixing CPS is their top priority this legislative session. Robert Arnold, KPRC, Channel 2 News.